Hi, I'm Tony Williams, and this is Brooklyn Savvy. Hi, I'm Tony Williams, and welcome to Brooklyn Savvy. Well, we're going to be talking about Alzheimer's and dementia with Dr. Fidelia Tavares. Now, you are the Director of Education for the Alzheimer's Association of New York. So we're just bated breath, want to hear what you have to say about this particular, disease. But before that, I'd like to introduce our Savvy panel. We have Nomiki McCrillis, Denise Arbisu, and Phyllis White-Thorne. This particular episode is part of a two-parter. The episode that we just taped, we talked about the play called Dot, where it's a comedy that explores the family dynamics of a matriarch who has Alzheimer's. So my thinking was, why not talk to our community about this particular disease? Because oftentimes, we think of it as senility or feeble-mindedness. So because I think about 4.5 million people suffer with Alzheimer's currently, talk to us about what is Alzheimer's, and then if you could tell us what is dementia.
Mm-hmm. Sure. Well, thank you so much for having me here to talk about this topic. And that play was really an amazing example of highlighting not only the warning signs of Alzheimer's disease, but also the challenges of families. And that's really what we exist at the Alzheimer's Association to respond to this huge epidemic. There's actually 5.7 million people in the United States who have Alzheimer's disease. The easiest way to explain this is to first start with dementia. So dementia is a general term for any disease that causes a pattern of symptoms that cause changes to memory, thinking, or behavior. There are more than 100 different types of diseases that can cause these symptoms, and Alzheimer's is the most common cause, and it's responsible for about 60 to 80% of the dementias that we see.
Now, what are the symptoms?
Right. So some of the symptoms that you can see, the number one warning sign is memory loss that interferes with daily life.
So confusion wouldn't be one of them? Like sometimes I've noticed that folks, as you get older, you get confused about facts and dates and stuff like that.
Right. So actually, the memory loss, that's a sign. You can also have confusion with time or place. So people who are not aware of the seasons, the date, somebody who's not what we call in the field oriented to place and time. Other warning signs are challenges in planning or solving problems. People who are misplacing things. Often what will happen with somebody who has Alzheimer's or another dementia, they will misplace their glasses. They won't be able to retrace their steps, and then they'll blame other family members for taking their glasses, their wallet, their keys. And so that's also another warning sign where you can have changes in personality or mood, and people being more suspicious, being irritable.
Paranoia.
Exactly. And so those are all.
What causes it? Meaning, is it just a natural part of aging? Or is there some other kind of cause to this?
Right. So Alzheimer's is not a normal part of aging. And the best way that I can describe this is even though the number one risk factor is age, in comparison, we know that cancer is very common and it increases with age, but nobody thinks that cancer is a normal part of aging. It's a similar sort of picture in Alzheimer's disease. Yes, your risk of getting Alzheimer's disease increases with age, but it's not a normal part of aging.
But what about that early onset that you hear, people in their 40s or even younger having these kinds of symptoms? How do you explain that? Is it a genetic predisposition? Is it environmental? Like what really causes Alzheimer's?
So in terms of age and who's affected, the majority of cases of Alzheimer's disease happen in what we call late onset Alzheimer's, which means in people over age 65.
Okay.
Of that 5.7 million that I told you, the majority of those are people over age 65, and only about 200,000 people have Alzheimer's that happens before age 65, and we call that early onset. Now, in terms of the cause of Alzheimer's, we are still trying to figure out all the reasons that explain the pattern of Alzheimer's that we see. We know that there is partly a genetic predisposition, but genetics is not destiny.
Right.
And then we also see that there's also a lifestyle component where people who have diabetes, who have high blood pressure, obesity are at increased risk.
So
of
why is that?
developing
Can you explain
exactly.
why diabetes or blood pressure put you at an increased risk for Alzheimer's?
Well, both diabetes and blood pressure can cause damage to the small blood vessels of all the body, but certainly the brain. And so we think that that injury predisposes someone to have problems in terms of their ability to repair their brain cells, the way their brain cells function. And so that's a very fertile area of research that the Alzheimer's Association is supporting. So as an organization, we're one of the largest funders and most impactful funders of Alzheimer's research. And so that's an area that we definitely support so that we can get more of an understanding of what is at play and the ways in which diabetes and hypertension and other diseases.
So what
put
is
you
the
at
plaque
increase.
that we hear talked about, the plaque in the brain? Yes.
So the two things that we see happen in Alzheimer's disease is one, this beta amyloid plaque, and so that's a protein that overgrows. And so the first you need to understand is that our brains are composed of billions of neurons. And the neurons are responsible for everything that we do, sending signals for us to move, to speak, to act. And what happens in Alzheimer's disease is you have an overgrowth of this protein called beta amyloid, and it forms plaques, and those plaques interfere with the function of the brain cells and causes certain brain cells to die. And first starts happening in areas of the brain that affect memory, and as the disease progresses, that beta amyloid plaque is happening in other areas of the brain that deal with movement, that deal with planning, that deal with language.
So what ultimately kills you with the disease? Meaning the brain just atrophies? And
right, because there is cell death of those different neurons.
Okay.
And what eventually causes death for people is usually from the prolonged disability, because the disease will progress to such a point that people can be bedridden, they can no longer move, it can affect their breathing, and so often people are getting infections, so an aspiration pneumonia, or getting infections from the fact that they're bedridden.
Phyllis, you had something.
I just wanted, what are some of the things that we might be able to do to protect ourselves, if you will, from getting the disease?
Well, firstly, it's really important to get informed. So I encourage people to learn more about the 10 warning signs so that they can go on our website at alz.org or call us on our 24/7 helpline. So that's an important point that people should recognize and speak to their doctor about it, because it's your doctor who will be trying to figure out, of those 100 different types of dementia, what could be causing those patterns of symptoms. And in terms of prevention, we know certain things can help you stay healthy and promote brain health. And many of the things that we know that are heart healthy are also brain healthy. So we also have another campaign at the association called 10 Ways to Love Your Brain. So those are things like eat a healthy diet, exercise. If you smoke, stop smoking, making sure that you're getting your diabetes and your hypertension treated, wearing a helmet, staying socially engaged, and making sure that you're learning new things. So those are all things that are body healthy, but also brain healthy.
So you mentioned brain trauma, earlier. If someone had fell off a bike, something like that, and all of a sudden they're acting perfectly healthy, but maybe 20 years down the road, could that be a precursor in terms of a possibility of getting Alzheimer's? Is it something that specific, or is it more like the genetic breakdown that you described?
Certainly traumatic brain injury it increases your risk, and so that's why we see, in boxers, in football players who have this history of a traumatic brain injury, that they have an increased risk of developing dementia. So that's why one of our 10 ways to love your brain is actually to wear a helmet and make sure that you wear a seatbelt so that you decrease your chances of having a traumatic brain injury, which predisposes you to developing Alzheimer's
I also
disease.
think that with an injury, and I have an example in my personal life, my dad had a diving accident about 10 years ago. There was a lack of oxygen to the brain. He came back up, and at that point, he just immediately transformed within the week. He was completely independent and transformed, and then was deemed with dementia, not Alzheimer's, but it's been a deterioration much slower than the Alzheimer's, kind of stages. And that was as a result of an injury. So I think it can be even as quick. It doesn't even have to be delayed. It could be immediate. You could see following a trauma, seeing the change of that and having the deterioration move forward.
Right, and that you're giving a perfect example of how I said before that dementia is a general term for any changes to memory, thinking, or behavior, but I mentioned that there's 100 different causes, and so yes, you can have an injury, you can have high blood pressure that causes a dementia, even people who have Parkinson's disease, so that's why it's so important.
No way it can be reversed? Can medication slow the progression of the disease?
So unfortunately, Alzheimer's is the 6th leading cause of death, and of the top 10 causes of death, it's the only cause of death that we don't have a way to stop the progression of the disease. We do have medications, and the medications provide a symptomatic benefit, but it doesn't stop the disease, and Alzheimer's disease, unfortunately, is a fatal disease. Now, that doesn't mean there aren't things that we can do.
A long time fatal, right? It takes a while. You don't
Right.
just
So
die
on
of that. You go
average,
like-
it can take 4 years to 20 years, but the average is 8 to 10 years after diagnosis that somebody.
I did not realize that.
That's
It's
that's
also
quick.
a disease that really impacts families and role and family dynamics and care needs of the individual along the progression of the disease. We've seen patriarchs and matriarchs, as in the play, that have had severe deterioration along the years, and that's where the family role and role reversals and loss and trauma kick in as far as caretaking needs, and sometimes that can be tremendously
So what's the best way to
challenging.
do that? There are times when I see friends who have parents that are struggling with this, kind of confront the parent, but the parent is someplace else. Meaning, or do you just play along with the parent's sense of reality? What is the most loving and nurturing way that you can deal with a person that has this disease?
So I think really it depends on the stage of the disease. And so in the early stages, somebody will have many of their faculties, they're independent, and so really the family member in that early stage is really playing a supportive role.
Absolutely.
How can we plan for the future? How do we respect your wishes? How do we put plans in place? And then the roles will change as we get into the middle stages of the disease, where the person's ability to think and plan is really deteriorated. The person may need a lot more help at home in terms of activities of daily living. So they're going to need help getting dressed, with finances. And so really family members, that role and that dynamic is changing considerably. And this can be a huge issue for families in terms of navigating, not only, if you're an adult child caregiver and you've always been in the role of receiving the nurturing, and now you're moving into a role to provide the nurturing. And similarly, it can be really challenging for spouses who have always been, partners and helpmates, and then now it's really one spouse who's providing all the care and support. And so many times this is super overwhelming for families. They're feeling guilt, they're feeling all these different emotions, they're grieving, and so they really need somebody to help them on the journey and to make sense of not only all the questions they have, but all the feelings and emotions, we certainly want people to know that they can reach out to us at the Alzheimer's Association, and that's what we exist as an organization. We were founded by a gentleman who was seeing his wife who had Alzheimer's disease and really wanted to do something with that experience and do something positive. And we've been around since 1980 and are really the largest organization in the country dedicated to helping people with Alzheimer's disease and other dementias. And so we have a whole host of free services.
Free services.
Free services.
And that was going to be my question. Because